Hello and welcome to another instalment of Monday Brews and Views. On this bank holiday morning, it is right now. If you're watching this, it might be in the afternoon, but I'm recording this in the morning. So just first off, I'm not a doctor, although I am mental health first aid trained. A lot of what I say comes from my own knowledge and experience, and it shouldn't really be used for an alternative for professional advice. That being said, I hope you find something useful, and maybe we can use it alongside some professional advice. Okay, so first off, I would like to acknowledge the death of the nation's Queen, with just a moment of reflection. So you can use this time for whatever you want, whether it be to just reflect on the time and some of the good moments, that you may have had experiences with the Queen, or some or whatever it is. I just want to honour her death, regardless of, there's been some good comments, some bad comments about it, but I just want you to take a moment just to reflect on whatever it is, on the passing of our Queen. So I'm going to start a minute of silence from now. Okay, that's a minute up, so I appreciate that. Sometimes the minute is all you need in order to sometimes gather your thoughts or whatever. But so thank you for taking part in that with me as we move on. Okay, so today we're going to be talking about drugs and alcohol. I've done this before, but we've been going onto my YouTube page. I thought I'd come back at it again. So a lot of us have taken drugs. A lot of us drink. Well, alcohol is a drug. We seem to forget that. Coffee is a drug. Caffeine. A lot of things, we just push on the corner because they're legal. We seem to think that it's okay, but alcohol is responsible for more deaths than all of the illegal drugs added up. So you add all the deaths that are caused by illegal drugs, and they're nowhere near as close as the deaths to alcohol. But I'm not the one. I'm not in the government. I don't make these decisions. But alcohol is nicotine as well. All sorts of things. A lot of those are responsible for a lot more deaths. Drugs are responsible for a lot more. Alcohol is responsible, out of all the drugs, is the worst one. Let's get it right. Some still do it. Some may do it occasionally. Some people do it more regularly, and some people are reliant on it. And that's what we call substance misuse. So we're misusing the substance, and the World Health Organization defines substance misuse refers to harmful or hazardous use of psychoactive substances, including alcohol or illicit drugs and illicit drugs. You have 4 types of drugs, and some of you may be aware of these, but you have stimulants. So they're the ones that get you full of energy. Caffeine, again, remember, it is a drug. It's a good drug, and it's fairly safe, to be fair, but it's still a drug. Cocaine, ecstasy, MDMA, they're stimulants. They're going to get you energetic, going to get you buzzing. buzzing around and depressants, alcohol. Again, we drink a lot of alcohol. We're a nation known for our alcohol drinking, aren't we? But it's a depressant. It can bring your moods right down, and slow you down, slow your reactions down. Cannabis is the same, although they're very different in, I guess, how they react in the body, but they are depressants, and they'll slow you down. Opiates, I guess, are another type. I guess it's not type of depressant, but opiates, they're in their own league of their own. Highly addictive, and mind altering, body altering, all sorts of stuff. So we're talking about heroin, and another one that we take from time to time when we're ill, codeine. It's in painkillers, isn't it? But we're okay to take that, aren't we? Because it's been prescribed. And then most drugs that are prescribed, if taken correctly, I must say this, are safe. But that's up to you to decide when you read the list of side effects of a lot of drugs, and there's a lot of unwanted things in that list. And sometimes you read it and you say death might be a side effect, but I'd rather not take it. But sometimes we have to. We've got severe chronic types of pains, and we have to medicate. And I would hope that those are prescribed medications in those instances. Hallucinogens, again, there's a lot of people taking mushrooms, like Mike Tyson is quite an advocate of them, isn't he, these days? And there are some studies that suggest it may potentially help with depression and mental health. You got to make your own judgment on that, but so there are a lot of studies out there that suggest that small, with certain doses of that may help you. And I'm not advocating that you do that. I'm just suggesting what some of the studies say. So the main things, like the effects of alcohol and medication, is that it can make your symptoms worse. So if you've got mental health, depression, anxiety, any other type of problem, OCD, these can exacerbate the problem. They can reduce the effectiveness of any medication, which may cause vomiting, sickness, dizziness, changes in your blood pressure, and increased risk of accidents as well. So again, these are things that you need to be aware of and mindful of if you're on maybe a short-term prescription, or indeed a long-term prescription. Sometimes you may potentially have to change your life, to save your life. Okay. Now, self-medicating. Now, a lot of the time, our go-to drug is alcohol when we're feeling a certain way, and we use it as a coping mechanism in order to make ourselves feel better, or distract ourselves, or just numb the pain of whatever situation we've got going on. And it seems to help in the short term. It seems to make us feel better in the short term, or at least can not make us feel the way it alters the way we feel, doesn't it? I would say it makes us feel that we can cope, and gives us some relief. But it can also make it feel worse. It can also, people with mental illness are the most likeliest people to do that, to drink excessively, or to drink at the weekend and just sort of get completely out of it, and then wake up and not know what's happened the night before, that sort of thing. And so it's worth bearing in mind that there are options, there are better ways. So things that kind of be affected by that. And if this is you, then again, maybe it's time to get some help. So mood swings, depression, problems with memory, altered perception of reality. I thought that was an interesting one when I read that. That's down to like you see, people will say things, won't they? Sometimes, and you misunderstand what people say, and that'll cause an argument, and then things like that and then next thing, those things are spiraling out of control. So there's some short-term effects. Long-term effects, obviously, increased problems with your own mental health, addiction to alcohol. If it's a regular thing, your body, becomes, it needs it. It becomes the sense that it needs alcohol in order to function. It changes the chemistry in the body. Social problems. Generally, if you become dependent on alcohol, use alcohol to get you through the day, it's going to have problems with your work. Because alcohol's one of them things that you can generally smell, and you can tell roughly more often than not if someone's drunk. So it's going to affect your social life. It's going to affect your work life, finances, and also then after that, obviously your career. Cause all sorts of problems if you're not careful. Heart and liver disease are quite common amongst those people who drink excessively and who are addicted to it. And withdrawals, you can get, like, trying to come off it or not having it for a few moments, it can cause you to have withdrawal symptoms. So again, self-medication is often not the way. Short term, yeah, I don't know what, for short term, if you have bear that in mind, I'm going to go down that line and saying that it's kind of alright, because so long as you are aware that it's just a short term, maybe just an evening or whatever it is, so you just need to just have a little blowout. But as long as that blowout doesn't turn into a long term thing, again, I'm not telling a lot of people who know me, that I've lived a life, shall we say, and I'm not a saint, so I'm not trying to preach to you, oh, you gotta be, this goody two shoes. But what I am trying to say to you is that everything in moderation, yeah, and that's the best way forward, especially when it comes to drugs. We're talking alcohol, drugs, all sorts of things that we become dependent on to get us away from whatever we're trying to deal with. Then at some point you must have it in your mind to sort of confront that. You have to confront that. In order to get over it, you're going to have to confront it at some point in time. So have that in your head. That, right, fair enough, yeah, I'm going to have a bit of a blowout right now, but come Monday, whatever, or tomorrow, I'm going to try and sort this out step by step. And that really that's a plan, yeah. So you're allowing yourself to do whatever it is you do and then not feel guilty about it, because that's what you plan to do, right? But then as soon as you get the opportunity to start changing whatever it is you need to change, then do that, yeah. And then you can be happy and proud with yourself, because you've done what you said you was going to do. And there's nothing better than that feeling that, yeah, I set out to do this and this is what I've done, and I'm making a step towards progress and improving my life by doing this, yeah. So if you're on the other side, and this, again, another reason why I'm doing these things is, like, also for people who may be going through problems and experiencing issues with their own mental health, but also if you are someone who's going through whatever topic I'm going to go through, try and give you some help on how you can help them too. So if you come across someone who's substance misusing, misusing drugs and alcohol, okay, try to take them somewhere quiet so you can talk to them. Be compassionate with them, listen to them, find out what they've taken. You might be able to sort of explain. You might get an understanding of how that situation is going to go, and if they start, like, coming down or whatever, that this might be part of that process. So find out what they've taken. Be patient with them as well. Let them talk. Let them get whatever it is off the chest, because that might be a perfect time, a perfect moment for them to talk. And depending on how high or drunk they are, that might just be what they needed right there and then. They might have just needed that someone there, and that might be a cry for attention, and they just needed someone to talk to. So be patient, be quiet whilst you listen to them. don't make any assumptions about what they're saying about what they've done unless they, give them a chance to explain themselves. And then ultimately signpost those people. We use that term signposting, if you don't know what I mean by that, but just to give them some places where they can go. So Drugwise, the website, all these things can be googled. ADFAM, so that's ADFAM.org. Alcohol Anonymous, Drink Aware, and our mate Frank. Yeah, Frank is a good one. I think if I'm right, that's probably a little bit more for the younger generation. I'm 41 now, but believe it or not, but so I'm not quite as young as you. So for the younger ones, Frank might be. It's a little bit more, frank, with the way that they talk, and the way that they put across what they're trying to say. Okay, so drugs and alcohol. Yeah, be aware of your own alcohol intake. To try and live a healthy life. Everything's good in moderation, but when you become reliant upon it, that's when you need to start making some changes. Okay, so that's kind of it for today. All right, but lastly, what I want to do, I'm going to probably doing these separately, but I thought I'd start off and see what sort of response I get with these. Is that just to kind of move off the topic for today. With mental health, I'll try to drop in little tips and tricks with you. Sometimes a little distraction tactic will help you move away from your thoughts and your feelings, and your negative thoughts and feelings. So something that we use in DBT, dialectical behavioural therapy, is distracting the mind, and one of those tips is riddles. So I'm gonna drop some little bombs for you, just little puzzles for you to solve. If you're feeling a certain way, maybe focus and meditate on these, and then post your answers in the comments if you think you've got it, or just keep it to yourself, or next week come back, I'll tell you what it is. Okay, so here's today's riddle. When you do not know what I am, then I am something. But when you know what I am, then I am nothing. What am I? I'll repeat that for you. When you do not know what I am, then I am something. But when you know what I am, then I am nothing. What am I? Answers in the comments, guys. Okay, so fill the void, everybody. Keep FKN smiling and keep FKN grinding. You are loved, you are needed, you are appreciated, you are worthy. Use those affirmations on a daily basis if you don't feel like you are, but because you are, and you are needed in this world for a purpose. Find that purpose and live your dream. Thank you very much for tuning in. I'll see you again another time. Take care.